Welcome to the Low Carb MD Podcast. No one is beyond help. No one is beyond hope. Nothing said on the Low Carb MD Podcast is medical advice. Please consult your own doctor before making any lifestyle changes.
Welcome to the Low Carb MD Podcast. Brian is going to be upset. He's stuck in clinic and he's going to miss a really good one. And I know after he hears this, he's going to want to bring you on Life's Best Medicine. We have a absolutely great guest, somebody I've known for a number of years. I've interacted with him on social media, and he is an absolute wealth of knowledge, wealth of experience, and just a kind, gentle soul who is now passionate about spreading the message of metabolic health. Dr. Eric Rodgers did his undergraduate degree at UNC, and he went off to do optometry school. He got a doctorate in optometry at Pennsylvania College of Optometry, which is now Salus. And he's been practicing in the Virginia area for almost 4 decades.
Chapel Hill,
Yeah.
North Carolina.
Yep, sorry. North Carolina, Chapel Hill.
There you go.
Yeah, you're in the Triangle, right?
There you go.
Salem. Yeah, that's right. And, we were just talking off air about what brought him into sort of healthcare. And we were talking about his own sort of metabolic struggles and how he overcame them. And I think maybe that's the place to start. What do you say, Eric?
Sure. Yeah, I'm happy to be here. I'm glad you offered me a chance to talk to your audience. So I'm 64 years old. And
we say 64 years young. That's what
yeah,
we say.
You go. There you go. But I got interested in my health early on, I guess. But I want to start with how I'm here today specifically, and just talk a little bit about the rally that's coming up that you're a part of, and then I'm going to back up and go over how I got to be in this space altogether.
Sure.
But, you just had Jess Apple on, and I'm in awe of her and what she's doing with the metabolic revolution, and the rally that's going to be in DC on October 13th, which I believe you're going to be speaking at.
Yes, sir.
Yeah, so you'll put something in the notes about that.
Oh, absolutely excited about it. We'll have it I think we had it in the show notes for her episode, but we'll certainly put it here. It's October 13th. So many speakers coming together. Dr. Asim Malhotra is going to be there. Nina Teicholz, Vinnie Tortorich, Dr. Eric Westman, Dr. Tony Hampton, and the list goes on and on. And yeah, absolutely, I'll be there.
Dr. Reed and Dr. Palmer, who
huge Dr. Reed.
They
and
figured
Dr. Palmer
prominently in my story.
Yeah,
so
absolutely.
Yeah, Jess inspired me to say, yeah, I want to come on your show. So here I am. All right. So how did my health get here? Well, when I was in grade school, I was overweight, and and I was teased for that, and that was rough. Luckily, I had a good core group of friends that stuck with me, you might say, whatever, and then made it through to high school, and had still a good group of friends. But then going off to college, I thought, you know what? I don't want to go to Chapel Hill this overweight. And so I said, I just sat there and said, I think you're only supposed to eat 3 times a day. I was literally eating all day, and I was eating all the wrong things. But I did. I sat there and I said, okay, I'll just eat 3 lunch or breakfast, lunch, and dinner. There you go. And I lost, I don't know, probably 20 pounds just doing that. Kind of amazing, really. And then I started running a little bit when I was in college. So now I'm in college and doing well. Although if I back up again, sorry, and I had some anxiety as a child. And I even had some insomnia in middle school, high school, just periods of it. But I got through all that and I did well in school. I did well in college. But by the time I'm now out of college and going to optometry school, I'm starting to get metabolic syndrome. I can look back and tell this now. And by the time I'm 30,
How did you notice? How did you notice you were getting metabolic?
well,
What were the signs you saw?
just the waistline and blood pressure. I was on blood pressure medicine before I was 30. And that's probably the most. And then I that's just had trouble maintaining my weight. And I was having trouble with anxiety. I just worried about things. I was a worrier. My sister calls it what if thinking. And that's boy, that just rings completely true. Okay, so there I am in optometry school, do fine there, but I am showing signs of being a little bit overweight, trying to address that with running, still know nothing about diet. Now I'm in my 30s and I'm in practice and I'm on high blood pressure medicine, more anxiety, and more trouble with my weight. Just gradually adding on weight like people do, I guess, at that age, and eating the standard American diet, just terrible food. So now we're coming up on age 40, and an interesting thing happened. I had a patient who, for when she turned 50, she said she wanted to run a marathon on her 50th birthday. So I said, hey, maybe that'll help with my blood pressure and my weight. And so I'll do it. I'll start running. I'll do a marathon at age 40. And I trained for it and I did it. And I kept running marathons for 15 years. So now at age 45, however, I was really undergoing bad anxiety and depression. And that's when I started on SSRIs.
And I'm curious. So
Yeah.
you're having insomnia, you're having a bit of anxiety, and then ultimately, maybe the food is a little off, but the exercise is there. I mean, did anybody say like, how's your sleep? How's your,
Oh,
are
sure,
you,
sure. I was,
how do,
yeah, at that age, I was twice. I was on Ambien, um, something like that for sleep. I had sleep issues.
so people just were medicating you right off
They
the bat.
didn't. I mean, they didn't know. All they knew were my symptoms, and they treated the symptoms. They treated the high blood pressure. They treated the insomnia. And eventually, what age? When I've looked back and I forgot, but when Lipitor came out, I got on a statin in my 40s. Um, so they treated the cholesterol. They treated the anxiety and the sleep, the cholesterol, and so then, okay, I'm running marathons, age 45, bad depression. So I end up with a psychiatrist, and I would stay with that psychiatrist for 10 years. So 45 to 55. And during those 10 years, I kept running marathons. And I was getting by, doing pretty well, getting by with bouts of severe depression. I was getting by pretty well. And then I would hit a wall or something, and it got a lot worse. And I would get through those walls and get to the other side and stay on the medicines and do pretty well. And then I had read, and I haven't studied this a whole lot, but each bout of major depression will be worse than the prior one. At least I read that somewhere, and that was the case. So then my third bout was age 55, and yeah, that was not good. I yeah, I had suicidal thoughts, of course, and I would have still running marathons. Yeah, 15 years into running marathons, still running marathons. And I felt better when I ran, no doubt about it. And my story is in Dr. Ead's book, and she probably can write it better than I can say it. But yeah, running was a huge treatment for me. and just helped tremendously. But there I am at 55, and I now am in front of a doctor, and I'd had those bouts of terrible depression, and I'm in front of the doctor, and she says, "You're pre-diabetic." And I was like, no, I run marathons for 15 years. And I didn't, this is in my head, of course. I didn't say this to her out loud. And then she said, she just looked at the chart, said, "Okay, well, eat less fat and exercise more." I was running marathons for 15 years.
She
didn't take the history.
It's not just take the history. Her concept of pre-diabetes is just.
Yeah. But it was actually did me a huge favor, because I knew in that second, I didn't know anything about diet or exercise or metabolism, diabetes, depression for that matter. I didn't know anything, but I knew in that second she was half wrong. There's no way I needed to exercise more. I was, what do you mean? I got to run 100-mile races? I should be doing the Western State 100 every year. Is that the answer? So that was interesting. So I just stepped away. I didn't say anything. I walked out of the office. A1C was, I don't know, maybe right around 6. And I just said, huh. And then I get obsessed with learning this. But I should back up prior. The year that was not good, as they were trying different medicines, the psychiatrist just randomly said, "Why don't you stop your statin?" And that was so interesting to me, because prior to that moment, that was about a year before I was told I was pre-diabetic. What do you mean, stop it? That's a medicine. I take it. I have to take medicine. What do you mean, stop it? They just said, "Stop it." So I did. And at the time that had no benefit, because I was just not in a good position. It was just didn't move the needle, but I stopped it anyway. But that was interesting, because that opened my mind to maybe everything I've been told wasn't right. That just stuck back there. And then when the pre-diabetic diagnosis came in, I thought, okay, wait a minute, maybe a lot of stuff is off. And so I had lost some weight actually right prior to being told I was pre-diabetic. And that was very random, but it was really because I just lost some interest in eating, to be honest. And that's not a common thing, I believe, with depression, but I really had. And so I ate less, and I lost a little bit of weight. So then there I am with the doctor, pre-diabetic, exercise more, eat less fat. And I just said, well, I'm gonna go to the bookstore. I'm gonna figure out, I didn't want to put the weight back on that I'd lost. And I wanted to learn about what was going on. I'm gonna let Dr. Tro guess the first book I saw. Literally, I remember this like it was yesterday. I walk into Barnes and Noble, and I'm looking there for a diet book written by a doctor.
Yeah, it's probably what, Atkins or Westman?
No.
Which one? Westman,
No.
Bullock? Who was it?
How Not to Die.
Oh, geez.
Exactly. So anyway, I get that book because it's written by a doctor, and it looked official, and doctors always tell me what I should do. And so I'm vegan for 6 months. I lose some weight. I get a little better. I'm still on antidepressant medicine, still on blood pressure medicine, not on cholesterol medicine. I just dropped that. So anyway, that's 2016. And I then go on social media. I don't remember which book it was, but in one of the books was the author's handle. And I said, maybe they'll reply to me. I really think it was Dr. Noakes. I honestly think it was one of Dr. Noakes' books. And I just saw his handle, and I said, well, I'm going to text, I'm going to send him a message. And he answered. And then I just got obsessed with learning on my own, had to. And I met Tro pretty early on, and he helped me early on. That was probably 2017.
So I was a punk, certainly.
Oh, it was so much fun. I really want to find some of those tweets, because I was I was already going down. I was following Dave Feldman very closely, and I was already thinking LDL isn't the only thing that causes heart attacks. You were less sure. You were more traditional
Yeah.
at that point, let's say.
Yeah. I think I remember some of those conversations, and I was like, look, even if there's other things,
Yeah,
I was
yeah.
like, it just still seems to be, I still think I have those tendencies, by the
Oh,
way, to
sure. No,
still,
it's part of the
yeah,
process. That's a whole nother conversation for when maybe Dave's film comes out. Dave Feldman, who we both know well, good friend
yeah,
of
yeah.
mine. And
But
I'm
certainly was lively discussions back in,
oh yeah,
gosh, it's
fun,
like I was
fun. It
thinking
was
about it almost 8 years ago.
yeah, I know. But so yeah, I do want to come back on when Dave's film comes out. I'll throw that in there. But so now it's okay. Now it's the end of 2016, and I found low carb, and I get obsessed with it. It was low carb, high fat back then. I found an old tweet I had sent out, and anyway, so by the end of 16, I'm doing keto pretty much, trying to figure it out. And then this is the lightning strike moment for me. I'm walking through Barnes and Noble again, and I'm pretty sure it was Psychology Today. Flipping through that, still on antidepressants, doing better, but not great. And Dr. Eid, oh, she's going to a conference in DC, of all places, where the revolution is going to be. And she said she's going to a nutrition conference on psychiatry. And I was like, what are you talking about? And I'm going to steal a comment from, I believe it was Hannah Warren, who's with Metabolic Mind, tremendous person, tremendous program, that if you have any issues with mood, any mental problems at all, you need to look at Metabolic Mind, and run by the Bazooki Foundation. But Hannah Warren she said something to the effect of, my thoughts did not create my mental illness. That's a pretty powerful statement, because when you have the problem, when you have depression, they try to think your way out of it. That if okay, so okay, we'll put a pin in that. So now nutrition and getting better, getting your brain better. Okay, well, I'll go. So now I'm there. I'm up in DC, International Society for Nutrition Research and Psychiatry, something like that, ISNPR. And I may have texted Dr. Reed, or not texted, but tweeted to her, said I'm going up there. So I don't know if she saw that or not, but I recognized her when I got up there, and Dr. Georgia Reed was gracious and would sit with me and talk with me. And I was just really just trying to figure it out. So I was getting encouraged, and it's fairly randomly. There was the main lectures, and then there was this side lecture, which not a lot of people went to. And I said, and I want to ask Dr. Chris Palmer, who gave that talk in 2017, I want to ask him what the title of that was, what drew me down there, because it was in the first floor. So now there I walk down there, and then there's Dr. Eid sitting beside me, and it's Dr. Chris Palmer, his first talk on keto for serious mental illness. And that stories that he gave of his patients cemented it for me. It was like, well, he's not making that up. These people got better with diet. And he's a Harvard psychiatrist. he's not making this up. So wow, that was 2017. I just said, holy cow, I'm locked in. And so I was, but I came back came back home, and back to the internet, because there's no doctor that knows any of this other than Dr. Palmer and Dr. Eid at that point, 2017. So come back home, just reading like crazy, going through everything. And I just start thinking, I don't need the 225 milligrams of Effexor that I'm taking, which is a high dose.
That's a high dose.
I
Yeah.
know it is. And there's story prior to that of more medicines, which I got off of. I'd have to dig through files to figure out what all that was. But I ended up on 225 Effexor, high dose. I knew it was. And I knew coming off that was dangerous because I was now fully engaged, reading everything I could find. I knew all the side effects of coming off that. But I'm like, I can't, I'm on my, well, other than reading everything Dr. Palmer and Eid said, you know, religiously, I had nothing to go by. I wasn't going to a doctor anymore, to be honest. I was on my own. So all I knew to do was taper it as slow as I could. And that's what I did. And it was probably 6 months, 8 months.
Took you a
Probably.
while. I mean, you did it the right way. Some people
Well,
just
don't
stop.
know. There is no right way. That's the interesting thing. It's
I think
dangerous if you
slow.
taper too fast.
That's what I mean. I think slow and controlled,
Yeah,
you
yeah,
know.
but it's also, I believe, dangerous if you taper too slow. I mean, it's less dangerous, but if the keto diet's so powerful that the antidepressant medicine it's overwhelms you. Your brain is going through so many changes, and if you're still on the medicine, you could go probably hypomanic, and that's definitely a thing. And so, if anybody's out there hearing this, absolutely find a doctor who knows something about this, or at least can monitor you while you improve your diet. Um, it's really very similar to type 2 diabetic that's on insulin, let's say, and you randomly tell them to go keto. Well, Tro, well, how might that not be good?
Oh yeah, they're gonna get hypoglycemic, especially if they're on drugs, you know.
Yeah.
Absolutely.
So,
And
so they need,
if you're on, you know, same thing with, you know, if you have this natriuretic effect, if you're on lithium, you can lose lithium in the urine, you know, doses have to be adjusted, certainly. Absolutely needs monitoring.
so the keto diet is as powerful as medicine. It's more in the case of mental health. I believe it's more powerful than just about every medicine out there. So when you combine it with medicine, which you're doing when you start a keto diet, that's kind of a dangerous period, and you need to work with a doctor. Look on Metabolic Mind. They've got all kinds of resources. There are now people to reach out to. Good grief. It's amazing. It's not like me. I was wandering in the dark. I was feeling good, but I was unsure. But anyway, I get all the way off the medicine and probably end of fall of 2017, and
I'm curious,
and I just
what do your doctors say? What is it? What does anybody say? You know, are they like,
I'm
okay,
I'm gonna hold off where I go there.
yeah.
So now I'm all the way off. My doctor's a lot retire in the process of this. I mean, I am 64, remember, and my doctors were getting older and they retired. So yeah, and so my new doctors, I'll tell them this whole story. And anyway, I got off the medicine in 2017. I've stayed keto since 2017. I've kept 30, 40 pounds off since 2017. Blood pressure's down since 2017. It's not just the best mood that I've had since an adult, since ever, maybe. It's just a calmness that you have. My sleep improved better than I've really ever had. Your ability to handle stress. It's just, well, there's stress. Okay, well, let's do something and let's move through it instead of just being overwhelmed by it. It's just, you cannot overstate the change in my outlook.
And
And
I'm
it's
curious, like what happens to in your practice, your relationships, your wife, you know, your family. I mean, you know, they must be seeing this and being like, well, what's going on?
Oh,
You know?
sure. Yeah, it's just a whole new person. It's a whole new person. And it's a better version of myself than I've ever been. So yeah, and yeah, patients, they saw when I was struggling, the ones I'd seen for 20 years, absolutely. And then, well, but here's the funny thing on that. Now, way on the other side, all these years later, they still think I'm losing weight. I wonder if your patients are going to do that. I mean, okay, it's 2024 now, I believe. This is 2017. I've been weight stable since 2017. That's when the weight came off. It's been off and stable since. They still come in and say, "Are you still losing weight?" Yeah, have you been practicing long enough for patients to ask you that?
Well, you know what? I mean, that's a long story, but I left I do get it often. I do get
Yeah.
it often.
Yeah. Oh, and
But
they're concerned. I mean, most people, I mean, they're like, well, wow, are you okay? You're really losing weight. So anyway, I got a little
I'm on
sidetracked.
a metabolic therapy. That's what you got to say. I'm on a special
No,
metabolic
it's so
drug.
frustrating. And I'm gonna steal another quote that I really like. So yeah, so metabolic therapy. Why don't I tell people, look at me, what happened? What do you want? It's so hard. People just don't want to. I don't know. The way it was Matt Bazuki. I'm pretty sure he said when he describes what happened to him, how his mental health got dramatically better with food. He says it's like I'm the only person on the planet that knows the planet is round. Everyone I talk to thinks it's flat.
Yeah. Let me tell you, the problem here is, it's sort of like there's a couple of people when they watch a movie, they know the plot sort of just in the beginning before everybody else does,
Mhm.
and you're like, oh, I know what's going to happen. He's a villain. You say it, you call it out loud.
Yeah.
And they're like, no, no way. And then you sit 2 hours and, they're the villain, right? That's kind of what it's like. They're just like, let's see this thing play out. And they don't want to believe what they hear. I mean, how much, how it's so hard for people to really understand that what they eat
Mm.
is going to impact their mood.
How they
It's
think.
hard
Yeah,
because we've been told that most of eating is just a calories issue
sure.
and a nutrient issue. And we've disconnected this idea of what we put in our mouth can have an impact on every single part of our body. And I think it's a spiritual dilemma also. I got to be honest, Eric, because if you think you are your feelings and your
Mm,
thoughts, then you're
mm,
identifying
mm,
with
mm.
it. And if those are diseased,
Absolutely.
that's all you
Absolutely.
know.
Absolutely.
And if you've been diseased your whole life
Mm,
or a majority of your life
mm.
in
Yeah,
an insidious way, that's all you know. So
absolutely.
most people only know really crappy health.
It,
That's all
it's
they
it's
know.
it's and it is. I mean, even when it happened to me in 2017, it's so hard. Okay, wait a minute. This is just food. So then I obsess on everything Dr. Palmer does, and I try to figure out all the mechanisms, and I get a grasp on a few of them, but I get it why people think, well, what do you mean? Food fixed your mood? What are you talking about? I understand that. And so what made me stick with it is the story. It was the story of Dr. Palmer's patients that he described. And it was Michaela Peterson's story. I mean, I've watched that. It's an old one. It's called Digesting Depression. If anybody's familiar with Michaela Peterson and Jordan Peterson, it's still out there on YouTube. And at the time, Jordan Peterson was like, well, this doesn't make sense. I see it happening, but it doesn't make sense. So I kind of like that. He was skeptical, but she was compelling. And
Yeah.
so another story so I think for someone where I
For you
was
to
back
see that,
then,
I think it was an like you're a clinically minded doctor.
mm,
We're also taught to be skeptical in school.
yeah, yeah,
But here you are, with people radically changing their lives, and it gives you enough of an inspiration to say, let me try that for myself.
Exactly. So
And that's all you needed. You were like, that's it.
It was that, and I was already getting better, and I was like, wow, this must be working. And there they are. They say it's working. I'm just going to stay with it. And yeah, and I've stayed with it all this time, and it's worked all this time. And it's just, so I want my personal story to help someone. The people in my direct vicinity, just, it's hard for people to hear it. They just, I think it just, oh yeah, he's talking keto again. And and so that's why I'm on here, to hopefully help make someone think or plant the seed. They may not be ready to try this now, but somewhere down the road they might say, you know what, Dr. Rodgers said it helped him. Maybe I ought to try it. Especially if I'm that person who said, well, I've tried 3 or 4 medicines they've given me. I've tried running marathons, maybe. I've tried sleeping better. I've tried everything, but what the one biggest factor, food, that nobody knew to try that.
Well, let's talk about each of those. There's a lot of data now, a great case series that was published in Frontiers that looked at, intractable, inpatient depression really improving with a ketogenic diet. We now have data on migraines. Certainly, we have data on seizures. We have data in anxiety. We have data in bipolar. We have data in anorexia. So I think that the tide is turning. We have clinical trials now ongoing. We have the field of metabolic psychiatry blooming. So I think
well, how many patients have you seen? I mean, I wonder, is this still like the zebras? Am I a zebra out there, or is there some momentum in patient care, at least?
I think you have to think about, well, so I wanted to stick around the topic of lifestyle because, you mentioned exercise, and just for the listener out there, exercise has been shown to be as effective and as an SSRI. And by the way, if you're in for anxiety and moderate depression, mild to moderate depression and mild to moderate anxiety, exercise has been shown to be as effective as an SSRI. And that is pretty much modulated through the intensity and duration of the exercise. But all of these factors, sleep duration, sleep quality, right? Exercise, movement, nutrition, these should be the 3 cornerstones of mental health management. And I think just removing offending agents, toxins, stimulus, dyes, colors, artificial flavors.
And finding out your insulin resistance.
Oh, 100%. And we're talking about diet. That's it.
Lowering. But wait a minute.
Carbohydrates.
You say 100%. I really want to know how many doctors. I've had 0 patients say, oh, my doctor said I was insulin resistant. I mean, I've had 0, and I've been in practice since 86. 0.
Well, we got to send you more patients. The thing is now we have, I think the problem has been, there's been a lot of silos, and this is one of the reasons why we went 48 states, 50 states soon, is because we need to aggregate the patients and the data and keep publishing and keep showing, and we need to fund the education. So we need to fund the SMHP,
absolutely.
The Society of Metabolic Health Practitioners, which is a conference, coming up in Boca. They need, if you're a health coach out there, doctor, an optometrist, a dietitian, doesn't matter, go get your metabolic health practitioner certification. You are supporting an organization that is building the movement here. But to come back, the treatment of mental health, it's long in the primary care setting been, here's your SSRI, have a nice day. And I feel like that's unacceptable.
Absolutely.
And they have now data, just deprescription. has a 60% success rate in the primary
Yeah.
care,
Oh,
for
yeah.
mild to moderate anxiety and mild to moderate depression.
Yeah. No,
And
I've heard experts say they lament that when you're in you're on this medicine for mood, and then you're having this side effect. Well, let's add this one instead of let's stop that one and try something different.
Well,
That
I think what this all points to is we need a multimodal approach to mental health. And it cannot just be, here's your script, see me, later. It's a chemical
absolutely.
problem.
But I want patients to look at Dr. Eads' website, diagnosisdiet.com, and in there she has a handout. Am I insulin resistant? Well, here are the tests you go ask your doctor for, because your doctor probably doesn't know HDL to triglyceride ratio, doesn't probably know fasting insulin, and doesn't know how important triglycerides are, period. What would you say?
I think the easiest way to determine insulin resistance, honestly, is the a finger stick or CGM. I mean, you can see it
Sure.
right away in real time.
Well,
And now they're over the counter, so you don't even need a doctor. You don't even need a doctor. You put on that CGM. What is your average GMI? What is your glucose variability? You can answer the question yourself on your own. No doctor needed. So I think that's the way to go. But if you need,
I want a quick story on that. So I did the finger stick in probably 2016, I guess. And I ate my normal breakfast, and it was Cheerios, skim milk, and blueberries.
oh, geez, that's a heart healthy breakfast right there.
I could talk forever on that. So annoying. I ate cereal till I was 56. And I would sometimes eat it for dinner because I'm in a hurry. I'll just have cereal. It tasted good. So yeah, I checked it. I checked my blood sugar before, and a doctor online said check it before. Checked it before I ate the cereal. It was in the morning. It was like 96. I ate the cereal. Check it an hour later, and it was like 165 or something. And just that whole idea, 90 to 1, that's crazy. I mean, that's just crazy. I mean, I really didn't know blood sugar numbers at that point, but I said, that's crazy. So I just threw it away. I'm going to do it again tomorrow. I did it again. 96, 165. So, well, I'm not eating cereal again. And that was it. That literally was the last time I ate cereal. Literally. That was day 2. Day 3, it's like on the 3rd day, I had bacon, eggs, cheese, coffee, half and half. 96, 99.
Yeah, you knew right away. Yeah,
That was it. And I've had 3 eggs, 4 pieces of bacon, cheese, coffee, half and half for 7 years.
Sounds like a pretty good breakfast.
Every day.
Sounds like a hearty breakfast. I don't remember the last time I had breakfast. I got to be honest with you.
Yeah, well, I don't need to lose any more weight. So that is a whole nother issue. If you stay on keto long enough, and depending on the person, you could undereat. And so I don't need to lose any more weight.
I don't think there's a world I could undereat, but this is the only way that my mind is not screaming for food. I'll tell you that, so I want to step back because, you go through this journey and it just sounds like you were a shell of yourself. And then you sort of start to break free with these simple little steps. And now you're empowered. Now I know you're so passionate about not only getting your story out, but, advocating for the people that are out there, because this, as you said, so many doctors don't even know about this. And so that advocacy is huge. And I know, we'll both be at that rally come October 13th. But I'm curious, has your clinical practice changed? I mean, have you learned a sensitivity to those people that came in that maybe had the anxiety that you notice, or has, diabetes and they have that terrible diabetic retinopathy?
Well, I'll occasionally, and I don't do it as much anymore, but I would occasionally ask patients. So when type 2 diabetic, I'm an 80-year-old patient, type 2 diabetic, what did they tell you about food? And they said, and this was not in the 1800s. This was a few years ago. They said eat 6 small meals a day, and I didn't say anything. I said okay, and I said, well, what about for breakfast? What they tell you to eat for breakfast? Literally, patients sat there and said Cheerios and skim milk.
Oh,
Literally said
geez.
that. I still didn't say anything. I just sat back for a little while, and then he said, I don't think that sounds right. And then I laughed and said, I explained that it wasn't right. So yeah, luckily I've got Dr. Westman literally 15 minutes from me. And I've printed out his office directions. Here's how you go there. And wait 6 months. And I've had a number of patients get better,
You
and
know what?
actually follow through with that.
You know what? We're gonna send you our app that you can give to
Hey,
patients
there
for
you
free.
go. I like
You
that.
know, we'll send you
Thank
our
you.
app. They can you
I'm
know,
not nearly as active as I need to be on that, but that's a great idea.
you
I've
know,
often discussed, yeah, absolutely, I'll do that
so
because
you can put it
it's
right
every
there.
day.
They could
I'll
scan
see
a
I'll see 3 people tomorrow. I could mention it too.
yeah, we can give them a QR code. Are you interested in losing weight for free? People don't realize the app's for free,
Yeah,
but you can download a QR code and they can just learn
send
on
me an
their own.
email. Send me the email with that.
I'm gonna have I'll have we'll send it out to you for
And I'm
sure.
also trying a new, I don't know if you've heard Dr. Unwin talk, but apparently he says something along the lines of, okay, here you are with your problem. I can treat you with food or with drugs. How do you want to go? I said that to a patient actually, and I'm not treating him, but I'm just saying this is how you could approach your problem. And maybe that's a way. I mean, people are coming to you, so when they come to you, they want to fix it without drugs. So
Most of the time, yes, most of the time, you know. Absolutely. So have you think some patients have gotten the message
oh,
or
absolutely, sure. A few have gotten better. Absolutely. And it's random. Every now and then somebody comes back in. You told me about that, and I lost some weight, and yeah, I'm getting a few of those back.
that's awesome. That must feel so fulfilling,
Oh,
like to see that.
it is awesome to see that because, and if it's someone that I've seen for a lot of years and they say, wow, you lost weight, how are you keeping that off? And then anyway, that might, a few years they come back and say, you know what, that did work. But I've had a few that, that worked, and then I just quit doing it. And so I don't know the answer there. For me, it's just like, I can't eat another way. It's just not possible. I had a couple of slips on the diet, one big one. And the next day I was like, oh yeah, okay, there's that mood problem. It went away in a day, but it was a reminder, just don't do that.
Yeah, it's like a drug. It's like a drug.
Yeah.
I think I think one of the things that it's so important is look, dance with the date that you brought. That's what
Mm,
Vinnie Tortorich says,
mm,
dance with the date that you brought, meaning if it's what got you here, it's what stabilized your moods, it's what kept your migraines away. If
yeah,
it's what helped you lose weight,
yeah,
don't change.
all that. I,
Don't change.
I like Dr. Westman. He'll say, patients ask me when can I come off the diet, and he says, "What got you better keeps you better."
Yeah, absolutely.
But so
Abs-
yeah, and it's not a diet. That's the other thing. It's just not a diet, and that's what people have to understand. It's not. It's you got to stop eating the junk food, which is almost everything in the grocery. You got to eat real food. You know this. You talk about this on every podcast probably.
yeah, yeah. I
But
mean,
but we also want to try, can we ever get the guidelines better? So back to the metabolic revolution, which you're going to talk at. I haven't seen you in person. Do you remember the last time I saw? Do you remember seeing me in person?
yeah, I saw you at Denver in
But
2019.
look at you. That is a good memory. That is
Yeah,
exactly right.
yeah. I
We
don't
were at
forget.
the Low
I don't
Carb
forget.
Denver. So anyway, I'll get to see you again there, which is great. Dr. Lustig, vital in my recovery.
Amazing books also, right?
I've read all his books, The Sugar, the Bitter Truth, the video. I watched that a few times. I'm just going to scroll through the people here if you don't mind. Jess
No, no.
Apple. If you haven't seen her talk at Dave's COSI 24, you got to watch that before you go to bed tonight. I'm just telling you. And anybody, look at Dave Feldman's YouTube channel, go straight to Jess Apple's talk. It's 15 minutes long, I believe. It's moving. Okay, then, and you know everybody else. Nina Teicholz, read her
Oh,
book early on.
Nina Teicholz's book, Big Fat Surprise. Can I just say something?
Yeah.
Nina Teicholz is like the matriarch of this movement. I mean, she is so well researched, well poised, and such an ability to find just the real good people in this movement.
Yeah, but I heard her say, and I hope I get this right, it took her 10 years. She researched 10 years for that book.
I believe it.
And that just blew my mind. I'm like, and it's like, and anyway, but still you put it out there and it's like, dadgummit, why don't more doctors read it? So yeah, Nina's and what she's doing with the try to change the guidelines is great. Now, new to me was Dr. Glant. You've already had her on, I believe.
Oh, Mariella Glant. She's a great doctor. She's working with in the South Bronx with people on Medicaid and doing some interesting things there. And she's an endocrinologist. She mostly is in Tel Aviv, but she's trying to get back involved in the States. She's absolutely great.
And she knows Jess.
Correct. Yeah, they're friends. I mean, I didn't know.
Dr. Hampton, I've met him at low carb conferences, San Diego Low Carb. I've met him several times. Just amazing person, amazing. And he's just, yeah. If I lived near him, he would be my doctor. Just saying.
I'm offended.
And then Vinny Torta.
Vinny's great. Oh my God, Vinny's great.
I've never met him in person. So this is going to be amazing. I'm gonna get to meet him at the rally. I cannot wait to say hi to him. And of course, Georgia Eade. I've talked about her a lot already. Dr. Westman. I'm sorry if I could say a few words about Dr. Westman. I'm researching stuff like crazy. Westman keeps coming up, just keeps coming up, and I'm reading everything he does, and it keeps going. And then I'll say, well, why don't I Google him? I Google him. He's 15 miles from me. And at the time, he was having a free monthly meeting, free. Just once a month, he would meet at a Holiday Inn or something, and just talk to people for free. And I went many times, got to talk to him. I got to know him a little bit. And yeah, he's going to be at the rally. He, of course, learned from Atkins. And then, of course, we've got Dr. Palmer there. Everybody's there. Dr. Palmer, we've talked about him. Dr. Cucuzella, I'm the big runner. He's going to be there, and he's the big runner. And then I don't know about Dr. Bernstein, haven't met him yet. I know of him, and he's a psychiatrist starting amazing things up north with a cord, I believe it's called. And then, wait a minute, Dr. Tro is going to be there too.
Apparently. They're letting this bozo.
So excited you're coming.
I'm excited too.
So
I really am.
Anything else you want to say about the conference?
No, I'm excited to go there. I know Seem Malhotra will be there as well, so I'm excited about that.
And I see Dr. Picard was just added.
Yes, it's going to be a good time, supporting a good cause, and I think we need to continue this grassroots effort. And I know the SMHP is supporting the metabolic revolution until they get themselves on their feet, and we're happy to do that. And I'm excited to go. Let's just put it that way. I'm excited to go.
Do you have any other questions for me that you think could help someone hearing all this?
Yeah, tell them what you ate yesterday.
Oh, okay.
Or what'd you eat for dinner today? Yeah.
Dinner today, barbecue, and then yogurt, and then a little bit of health code in there. I'll throw in Dr. Bickman, who I've learned, and you have too, learned endlessly from. I put 1 scoop of his health code, a little bit of water,
that'll make anything good.
Greek yogurt.
Yeah, that'll make anything good.
I ate that a lot, and then that's what I had for breakfast was 3 eggs, 4 pieces of bacon, cheese, and I did put in green peppers and onions, fried a few of those up. And that's breakfast. And then lunch, guess where I went for lunch? If you knew me at all.
I don't
Five
know.
Guys. Okay, I'll just give them
Five Guys.
Five Guys.
Five Guys. I was gonna say I went to McDonald's. So
Yeah, 3 cheeseburgers, no bun.
hold on. How much did you end up paying? And I'll tell you how much I paid.
It's not good. It's not good. If I now don't buy the drink, but it's $14 without a drink. It's 17 with the drink.
I got 6 quarter-pound hamburger patties with 3 sides of cheese and 3 sides of bacon from McDonald's for $14.
Oh, how many quarter pounders?
6.
Dang, I drive by McDonald's to get the Five Guys.
Yes, if you want to save some money,
I need to try that.
So if you're so that's funny that you go to the Five Guys. Yeah, I eat 1 meal, max 2 meals. So it's usually a pretty big meal.
All right. So
yeah.
that's it. That's what I had.
Got it. Great. Yeah, that's it. Well, we got to bring you back. I think
absolutely.
I know you've been interviewed
I
know you've been interviewed in a documentary that's yet to be released. So when that's released, we got to get you back on to talk about that and talk about some other things. So
hey, I want you to come to COSI next year.
I'm going to do my best to get out there. It's so hard, Eric.
Yeah.
It's so hard.
I know you got too much going on.
Yeah, I got to slow down a little bit.
That's fact.
Yeah.
All right.
Thank you for coming on, Eric. How do people find you?
Well, right now, the best way to find me is on X or Twitter. It's just at Dr. Eric Rodgers, EricRodgers. And I would love for someone to ask me a question on Twitter or X. And that's it for now. I do want to, once I retire from optometry, I definitely want to become a health coach in some fashion. I just don't know how.
You're hired. Done. You're hired.
All right.
Already done.
I'll hold you to that.
We'll open up our mental health division.
There you go.
All right, Eric. Have a good one, Dr.
Thank
Rodgers.
you.
If you enjoy the show, please consider supporting us on Patreon by going to lowcarbmd.com.